Hi everyone, welcome back to What's Up Doc. My name is Dr. Michael Cohen. I'm a family medicine specialist, and today I wanted to speak with you about suicide headaches, which are otherwise known as cluster headaches. I want to speak about these because they're a problem that's very close to my own heart, my own experience, my own head, and because I think I have something to add which is not typical in the medical literature. I want to talk about headaches insofar as describing what they are, how they feel, especially to those of you who've never had one. Hopefully most of you never have and never will. I want to tell you about my personal experience. I want to tell you how I worked out that these are the headaches that I was having, and also my thoughts on any usually recommended treatments and complementary treatments as well. Firstly, to say that these are extremely painful headaches. They're described as probably the most severely painful condition that a person can experience, and not to upset anybody, but people say that they're worse than having a baby. What makes them typical is that they happen in clusters. That's why they're called cluster headaches. So they happen around the same time of day every day for a period of time. They can go on for a week, they can go on for a month, they can go on for months. And usually they happen once a day, but they can also happen multiple times a day. And their time can go on between 15 minutes up to 3 hours typically. And when a person has one of these headaches, they are totally debilitated by the pain. They're usually on one side of the head. They are usually centered around one of the eyes, and it's usually the same side of the head in each person for any given cluster of headaches. And usually they tend to have the same side always. They can be triggered by strong smells, they can be triggered by sounds, they can be triggered by stress, by heat, by not sleeping well, and alcohol as well. Particularly wine can do it probably even more than spirits. So, what causes these mysterious headaches? Well, actually nobody really knows, and there's been quite a lot of investigation around them. They found that low levels of what are called neurosteroids are often associated with these headaches. And one study has also shown that low levels of melatonin, which many people know is a hormone that's naturally released in the brain, can actually cause cluster headaches, specifically at nighttime. And as a result of this, there's also been treatments which have been suggested and used using melatonin to alleviate cluster headaches, which occur at nighttime. So it can be pretty effective. Other than that, we don't really know much more about them. So why are they called suicide headaches? Well, it's pretty obvious. They cause people to commit suicide sometimes. But seriously, they are extremely severe. They can very much disrupt a person's life, and the effects of them go well beyond just the headache. They prevent people performing all sorts of tasks, and the regularity with which they happen is something that can very much damage a person's social life, damage a person's work life, damage a person's sleep. So it really is incredibly important to diagnose them properly and treat them properly. So I want to tell you about my experience of cluster headaches. I want you to understand how they started. First of all, they started around 5 years ago. I started getting pains on one side of the head. I went to see a neurologist because they were pretty severe and quite disabling. And initially I was told that these were probably some form of migraine, but with time it came out that these probably were cluster headaches. I ended up having an MRI of my brain, which thankfully didn't show a tumor or anything like that, and didn't show any trapped nerves, which can also cause these kinds of headaches. And I started trying various forms of treatment, including regular painkillers to other methods. Now, typically, these headaches are managed by there's a regime of different drugs that can be used. But seeing as I don't like using medications unless I absolutely have to, I started searching for alternatives because I really didn't want to take some of these drugs because of the side effects that they have with them sometimes. So what are the typically recommended treatments? Well, there's a whole array of different types of treatments that can be used depending on what type of headache is, whether it's in an acute phase, whether it's what's called the transitional phase, or whether we're using this for prevention. You'll see drugs with the name which ends with the word triptan, and these are drugs that were typically designed for migraine headaches, and they have effects on the blood vessels in the brain. They often also cause side effects like foggy thinking, which often means that people don't like taking them, but they can be quite effective if taken immediately. You'll see oxygen there being used, and oxygen can be incredibly useful, but many people don't have access to oxygen, and certainly not when they have an attack. You'll see another drug here. It says prednisolone, corticosteroids. The problem with corticosteroids is that they do have side effects. Depending on how long you end up taking them for, they can cause weight gain, they can cause sugar levels to go out of control, they can cause a person not to sleep well, just as a few examples. And you'll see other drugs here in the preventive part. It says verapamil, lithium, topiramate. Well, lithium and topiramate, lithium is used for, lithium is a psychiatric drug in general. Topiramate is an anti-epileptic drug. Verapamil is a drug that works on the blood vessels as well and is also used in blood pressure. And then melatonin, which is a natural hormone that can regulate our sleep cycle. You'll also see on the right side of the table, you see it says here suboccipital steroid injection and greater occipital nerve blockade. So these are actually injections being given into the skull, in one fairly superficially and one quite deep into what's called a nerve ganglion by the edge of the jaw, and these can be used to treat cluster headaches. There are also other things like Botox, which you've probably heard of, which means giving an injection, a series of injections into one side of the head, and they can work with variable effectiveness. So from this table, you can see that there's a wide array of different treatments that can be used. I want to focus down on a couple of them, which I've actually used myself, and I use them because of them not having side effects and them being really quite safe. So one of the first ones I used was oxygen. So I actually have an oxygen concentrator, and I have one at work and I have one at home. And when I go through a period of cluster headaches, I literally put on the machine and put a mask on, and as soon as the headache starts, I start using the oxygen, and often within minutes it's completely dissipated. So this is one method. Another method that can be used, which I haven't used but which I'd be interested to use, would be melatonin, simply because it's pretty safe and tends not to have side effects, and because I do get clusters in the middle of the night sometimes when they happen. The other things I'm less interested in trying, I don't really want an injection into the side of my skull, but I would also like to discuss another method that I have used. One of them is breath holding, so actually taking a deep breath and then holding my breath for a while and then releasing, and I've done that quite a few times and been able to stave off a cluster attack. And another thing which is interesting is that there are devices called neuromodulators or neurostimulator devices, and you can buy these actually online, and they have gone through testing for safety, and you can literally fix them to your forehead, and you press a button and you set the level of the stimulation, and it causes a kind of gentle buzzing stimulation over the forehead, right in the center or to one side. And very often this can cause the headache to settle down, and they can also be used in a preventative fashion. And if I was going to advise anyone to try anything, obviously having spoken with their doctor and got proper specific medical advice for them, I would definitely say that this is a very good option for many people as something being worth trying. So something I think it's very important to summarize is that, as you can see from the table that I showed you before, a lot of the medications that are used are quite strong and can have significant side effects. I would first of all advise anyone who thinks they're having cluster headaches that they must see their own doctor. They likely need to see a neurologist, a brain specialist as it were. They may need to have an MRI, and they may need other tests, including blood tests. The Next thing I would say is that if it's been shown that these are definitely cluster headaches and nothing else, then technically there's no reason why you can't try other methods rather than jumping straight into using quite strong medication. And the things that I mentioned earlier, oxygen, melatonin, breath holding, the neurostimulator devices, these are all things that are extremely safe and tend not to have any side effects at all, as long as they're used correctly and according to the instructions that are given. And I would tell people something else, which is that your body is your body. We are doctors and we try to give people the best advice that we can, but we're working within the framework of the person on the side who's saying, oh, well, how about trying this? How about trying that? At the end of the day, you know yourself best and you know how you respond to things. And as long as a condition has been diagnosed correctly, and as long as things are being done in conjunction with medical advice, then it's worthwhile reading and educating yourself about your own condition, and within reason, trying out safe alternatives, even sometimes simultaneous to other medications, with a hope of being able to stop those medications and to start using things that are treatments that are far more in tune with our natural bodies, let's say. So thank you everyone for watching this. I really hope that this video has helped you at least to start thinking about cluster headaches and perhaps other problems as well. And I hope that it's also made you want to learn a little bit more about them for your own benefit. Let me know if you have any comments. Put these in the section below, and tick the like so that we know that you like what we're doing, and give us suggestions on what else you want to know about. Thanks for listening.